Chapter 8: Reclaiming Our Health, a Counteroffensive Blueprint. History shows that takeovers can be reversed. This is not a moment for despair, but for a strategic counteroffensive. The single-payer solution is not a radical fantasy. It is the logical, moral, and economical endgame, the only system fundamentally aligned with the principle that healthcare is a human right. Our blueprint for this counteroffensive is a practical, three-phase plan that leverages America's most powerful, yet often overlooked, asset in the fight for rational healthcare: the Veterans Affairs Medical System, VA. The VA is not just a healthcare provider, it is a living prototype for the single-payer model, proving that a publicly funded, integrated system can deliver high-quality care at lower cost. A three-phase plan to transform American healthcare. Phase 1: Stabilize and prepare, years 0 to 2. Leverage the VA's data and expertise. The VA's success in controlling costs and achieving better patient outcomes provides the irrefutable evidence needed to counter fear-mongering. Its data on lower costs and higher survival rates will be the cornerstone of the public case for reform. Deploy the VA's fraud prevention model. While we rein in private sector abuses, we can simultaneously strengthen the VA's robust oversight systems to serve as a national model for integrity, contrasting its public accountability with the rampant fraud of the for-profit system. Phase 2: Offer a public choice, years 2 to 4. The VA as the public option anchor. The new public option should be structurally modeled on the VA's integrated approach, prioritizing care coordination and prevention over billing and denials. The VA's electronic health record system provides the technical blueprint for the modernized IT infrastructure needed. Integrate the VA into the broader network. To immediately expand access and demonstrate the efficiency of a unified system, the VA network could be opened to the first cohorts of public option enrollees, such as low-income families in areas with VA facilities. Phase 3: Achieve universal coverage, years 4 to 6. The VA as the prototype for regional health systems. In the final system, the VA's structure can serve as the direct model for regional, publicly administered health networks. Its focus on preventative care and chronic disease management becomes the national standard, finally aligning financial incentives with patient health. Financing the vision, the net savings model. The transition would be financed through progressive taxation, but this must be framed correctly. It is a replacement, not an additional cost. Eliminate premiums and deductibles. The new public financing system would replace all out-of-pocket premiums, deductibles, and co-pays. For the vast majority of families and businesses, this will result in significant net savings. Leverage system-wide efficiencies. The hundreds of billions saved by eliminating insurance-related administrative waste and negotiating lower drug prices would be redirected to fund universal coverage. Can we afford it? The evidence says yes. One of the most persistent myths about single-payer healthcare is that it's financially reckless. But when we examine the data, a different picture emerges, one of potential savings, streamlined administration, and more equitable coverage. These findings challenge the assumption that single-payer reform is economically unfeasible. In fact, the data suggest that a well-designed system could reduce national health spending while expanding access and simplifying care delivery. Even conservative models show that cost increases are modest and potentially offset by long-term efficiencies. This blueprint is not a leap into the unknown. It is a deliberate, evidence-based strategy built on a foundation we have already laid. It leverages the proven success of the VA and the popular Medicare program to build a system that serves people, not profit. So, there it is. The blueprint is drawn, and the case is clear. A single-payer system isn't a radical leap into the dark. It's a step onto a path we've already built and proven. The VA shows us that when you remove the profit motive, you get better care for less money. The financial models prove we can afford it, and the three-phase plan shows us how we can get there. This isn't about wishing for a different system. It's about strategically expanding the one that already works, leveraging the VA, strengthening Medicare, and building a system where health is a right, not a privilege. Which means the final question isn't about policy. It's about power. Who will build the political will to make this happen? How do we overcome an industry that spends billions to protect its profits? The answer lies not in Washington's corridors, but in our communities, our clinics, and our collective voice. This leads us to the final word, the conclusion of hostile takeover. If we have the evidence and we have the plan, what will it take to win?